Off, what is bipolar disorder and how does it come about?
So bipolar disorder is a mood disorder. It's the most misdiagnosed mental disorder in the United States. 21 million people are affected by this disorder. So there's classification for mood disorders. The first mood disorder is major depressive disorder, which is definitely a more common and definitely misdiagnosed and the most undiagnosed. So the fact of the matter is that, if you're human, you have depression, but with major depressive disorder, what comes with that is, constant feelings of hopelessness, dread. Often a person may be living in the past, or maybe some type of trauma that was in the past that they cannot seem to get over. And they see themselves duplicating themselves in patterns. And with major depressive disorder, it comes with a very, very like a monotone, low type mood where it's hard to actually be happy. So an example of that would be if they may have graduated from college or something like that, and everybody's excited, but deep down inside and how their behavior is, it's hard for them to be happy when happy moments come. So that's definitely a core of major depressive disorder. The second one, which this is another classification under a mood disorder. So when I say mood disorder, oftentimes you hear bipolar. So with bipolar disorder, there's two types of bipolar disorder. There's bipolar 1. Bipolar 1 is, so that comes with, it's considered to be like a hybrid a bit. With bipolar disorder 1, the most common symptoms is the manic state. And this is what I call it from my studies and my expertise in this field as a therapist. I would call it thinking about thinking. So it's kind of like your engine is constantly running, but it's sitting idle. Granted, if you do that to your car and you have the engine going, it's not going to blow it up, but it's going to put stress on the engine. So consider the engine to be your brain. So during these manic episodes, lots of triggers, relationship things, stuff like that. We live on planet Earth. So, even if you went to another Earth, somebody's going to follow you. So you got to live around people. So with bipolar 1, oftentimes, another thing that I would say, I wouldn't actually call it a benefit. I would call it a type of form of consciousness that some people can tap. So it also shows that during these manic episodes, when people are thinking about thinking, there's a lot of musicians, a lot of movie artists, a lot of poets, a lot of business owners that may have been misdiagnosed or undiagnosed with bipolar 1, and it shows that the brain activity is abnormal compared to a normal brain. So when I say abnormal, what I'm meaning by there is something different about the manic state. They're extremely creative. Quite a few painters. So, and the reason for that is during the manic state, when you look at the brain diagrams, it's red, and it's oftentimes that's a part of the brain that the average person does not access on a regular basis. So it's not uncommon for individuals diagnosed with bipolar 1 to just have this level of creativity where they'll, get in an introverted space and their ideals just flow. And it's just, and oftentimes when that's brought to the world, it's looked at as a masterpiece. But like I said, this is the most misdiagnosed disorder, but there's a lot of people that are brilliant, that a lot of things have been brought to the world unbeknownst to you may not have known that they were creating these brilliant things during manic depressive episodes. So bipolar 2 disorder is something a bit different. It's evident if we have a mania, which is frantic high, then we have something that will be the opposite of that, which would be a hypnomania that comes with bipolar 2 disorder. So this is where you get that real low, I'm going to be sleeping for 3 days. I'm not going to get up, right? Wears on motivation really, really quick. But keep in mind, Just because a person is bipolar 2 disorder does not mean that they could not be hyper in the middle, because they still may experience these manic episodes where they're thinking about thinking. And oftentimes it's a hybrid, but there's not a name for the middle piece. So that's the reason why it's classified as a mood disorder. And it's those three, which is major depressive disorder, bipolar 1 disorder, and bipolar 2 disorder. In addition to that,